Doctor, good afternoon, Mr. Johnson. I'm Dr. Anderson, one of the medical doctors. Before we begin, may I confirm your identity and date of birth, please? Patient, yes, I'm John Johnson, born on March 15, 1972. Doctor, thank you, Mr. Johnson. Today, we're here to discuss your recent test results. Before we proceed, may I have your permission to discuss your diagnosis? Patient, yes, please go ahead, doctor. Doctor, thank you. Is there anyone else you would like to have present during our discussion? Patient, no, it's just me today. Doctor, alright. Before we go into the details, may I ask how much you already know about your current health condition? Patient, well, I know I've been having some health issues lately, but I'm not entirely sure what's going on. Doctor, I appreciate your honesty. I'm here to provide you with some information about your recent test results. I'm afraid they indicate the presence of a condition called pheochromocytoma. Patient, pheochromocytoma? I've never heard of that before. What is it? Doctor, I understand this may be overwhelming, Mr. Johnson. Pheochromocytoma is a rare tumor that develops in the adrenal gland just above your both kidneys, causing an overproduction of hormones called adrenaline and noradrenaline. This can lead to various symptoms such as high blood pressure, headaches, and sweating. Patient, tumor? Is it cancerous? Doctor, I'm sorry to say that pheochromocytoma is considered a tumor, but it's typically not cancerous. However, it requires careful management and attention. To provide you with the best care possible, I will be referring you to our team, which will have a team of gland physician, surgeon, psychotherapist, social worker to formulate the proper care plan for you. I will give you some leaflets that will help you better understand your condition, and it also contains the website where you can get the necessary help, and we are always there for you. Patient, surgery doctor team? This is really serious, isn't it? Doctor, it's a serious condition, but with proper management and treatment, many patients can lead normal lives. We will be referring you to our cancer doctor team, who will discuss the treatment options with you. But before we proceed, you can ask me if you have any other concerns. Patient, can it be cancerous? Doctor, in 10% of cases it can be cancerous. We need to do further imaging study to determine that. Patient, okay. I have 2 kids. Does it also go to them also? Doctor, I appreciate your concern. 10% of cases can be familial, that means can get transferred from you to your kids. Patient, okay. Do they need to be checked out? Doctor, I appreciate your concern. The cancer doctor team will be in the best position to answer that question. I'd like to ask a few questions about your social history. How has this diagnosis affected your quality of life? Do you have a strong support system at home? Patient, it's definitely been tough, and I'm worried about how it will impact my life. My family is supportive, but it's still overwhelming. Doctor, I can hardly understand what you are going through. Me and my department will support you as much as we can to help you get the necessary treatment. Before that, it's essential for us to consider all aspects of your life. Can you tell me about your job, and have you noticed any changes or challenges related to it since learning about the diagnosis? Patient, well, my job is physically demanding, and I'm not sure how I'll manage with the treatment. It's a concern. Doctor, I appreciate you sharing that. We'll take that into consideration when planning your treatment, and I will write a referral letter to the occupational health worker. Additionally, let's discuss your smoking and alcohol history. Have you ever smoked, and do you consume alcohol? Patient, I used to smoke, but I quit a few years ago. I do drink occasionally. Doctor, that's good to know. Now, I also want to inquire about any specific concerns or questions you may have at this point. Patient, I'm just worried about what the future holds and how this will impact my daily life. Doctor, it's completely natural to feel that way, Mr. Johnson. We will work closely with you to address your concerns and develop a treatment plan that takes into account your overall well-being. Before we conclude, let me summarize what we've discussed to ensure I've accurately captured your understanding. Patient, thank you, doctor. Doctor, you're welcome. Moving forward, we are here to provide support and reassurance throughout your journey, If you have any questions or concerns, please don't hesitate to reach out. I will share with you my phone number. We're committed to helping you every step of the way.